Welcome, Julia. Can you tell me something about yourself?
Thank you so much. My name is Julia. I am 27 years old. I am from Brazil, but I currently live in Switzerland. HR manager and also a flight attendant.
Oh, nice.
And sometimes I play model, but it's just for a hobby. I am not a professional model.
Oh, that's very nice.
So yes, to make fun for myself.
We are gonna do liposuction, J-plasma with high definition and rib remodeling. That will be a skinny BBL, shaping your hips. We don't have so much fat. These blue dots are my incisions. We will have small incisions here. I will hide them under your underwear here. That will be at your umbilicus to at the junction of your breast. I will do definition lines, so you will look sporty. Your breast median is a little bit to left, but I will use your original anatomy. So our line will be this iMed line. According to your breast, it will look a little bit. At the posterior part, we will have 3 incisions for our liposuction.
It's about the BBL.
Actually,
Here I told you I don't want to put fat.
yeah, your projection is very good, but you have deep hips here, hip dips. Actually, this part will be okay if you ask me. We should use our fat to augment this area.
Okay.
Okay, so we will have limited fat and I will make it to have a rounder butt and sporty. I will make our definite drawing for rib remodeling and operation room. I will be going for your lower 3 ribs. So we will achieve a smaller waistline here and I will deal with this area with liposuction.
And what did you make to consider the rib remodeling surgery?
Because I was satisfied about the shape, about the appearance, and also I was feeling uncomfortable to go out, to wear some kind of clothes, also to go to the beach, to wear bikinis, kind of things. For me, the shape was really uncomfortable. And this is the reason why I considered to do this kind of surgery to apply the best shape for me.
So you always considered an hourglass figure on snatch waist, small waist?
Yeah, just to look more and more, how can I say, with
hourglass.
Very nice, good health.
Yeah.
With liposuction, we will achieve a nice etching here. I will make these are snatched and we will achieve a smaller waistline. We will remodel your ribs so you have very prominent ribs here. We will be safely making them smaller. We will be using a very tight corset for at least 2 months. More painful than our normal BBL because it's actually basically a green stick fracture of your ribs. And we are doing it in a controlled way, but it's a little painful, but you will get used to it. And after a few weeks, you will be much comfortable.
And this side here, for example, you put the...
Actually, I will be primarily focusing on your dips here, that part. So if I have enough fat, I will also augment this area. But I can't promise. But even though when this area gets smaller, this part will be relatively bigger.
How did you feel when you heard that this surgery was possible in Turkey and it's safe? Because what you see is a rib removal surgery, but what we are doing is rib remodeling surgery. How did you feel it when you heard that it's in Turkey possible?
For me, it's more comfortable because discover that I don't need to remove from it, much more comfortable. I know that the surgery will be a little bit complicated, that there is a pain, but this for me is quite normal. It's a surgery.
Yes, no pain, no gain.
For the procedure, for the method, for me, it's quite comfortable to know about that.
Okay, very nice.
And we are gonna do a chin implant. I'm gonna use a little bit bigger implant than what I am using for most of the patients. I will be using an anatomical implant here. I will be augmenting this part. In your jawline, it's very nice, it's coming very nicely, but at here you have a little bit micrognathia, which is your chin is recessed. We will permanently augment this area. I will do an external approach, which means you will have a small incision under your chin, but don't worry, it's really invisible. It will stay under your chin, and it heals very nicely in that area. And I will do liposuction and J-plasma for your chin here, so this skin will be going to be tighter. I want to do also a little bit liposuction to your cheeks here. It will give us much more definition for your jawline. The problem with cheek liposuction, at first weeks you can have small asymmetries at your corner of your mouth, but don't worry, it's transient, not permanent one. Since I will be using J-plasma for here, because of this, at first we can have small asymmetries at your mouth, but it's transient. And with a good aftercare, we will achieve nice results. Do you have any questions for me?
No, I don't.
Okay, we will prepare everything, then we will be taking you to our operation room. Operation room is ready. Operation will take around 4 hours. Okay.
Yeah, so thank
Okay,
you.
see you. Bye-bye.
How did the consultation go? How did you feel? How did you prepare for the surgery?
I felt quite good. The doctor was really kind and he was able to provide all information that I was trying to find out. And for me, it was really nice job.
Okay, very nice. How do you feel right now for the surgery? Are you psychologically, physically? Are you nervous?
I am prepared, but at the same time, I'm very anxious because it's a surgery and always we are just hope to find out the after surgery. I know that it's too early to discover about the results. It takes a lot of time, but this is what generates my, I think, anxiety. But for the moment, I'm quite comfortable and confident about the surgery and how it will be.
Okay, and what would you advise other patients who are considering surgery?
First, if you have the same problem as I have, if you want to remodeling your shape, if you want to feel confident about your self-esteem, your body, I think this is the best method and the best doctor to do it.
Yeah.
Because I feel really confident about him, this technique, and all the environment.
Okay, super. Then I'm gonna wish you good luck with your surgery.
Thank you.
And then we will see you with your checkup. And good luck with everything and get well soon. Okay, bye-bye.
How are you?
I am good, better than
Let's come here. Now today we will remove our drain
Okay.
and we will change our corset.
Yeah.
Or second stage, because all the swelling is going down. We won't put this on, you will use it on at nights. I will take off your drain. It will be easier, don't worry, easier than front one. Now I will take off tapes here. Yeah, I will put spray. Your neck is also very swollen. After this swelling is gone, we will have very nice definition of your neck and chin. Today you will get your first massage. It was 72, I think. Yeah, that's the swollen part. Again, after months, it will be much different. Everything seems nice. Where is the most painful part? Yeah, our
Where
ribs.
it was the rib procedure?
Exactly. We have green stick fractures around here. Now, after that time period, we need two things. One, good compression. Second is lymphatic drainage massage.
Yeah.
Today we will be doing our first session and we will start to see nice results. After 1 month everything will be different, and around 2 months we will have very nice definitions.
Okay.
We put 500 cc fat on each side. I did hip augmentation and projection increase. We were able to get good amount of fat.
Yeah.
It was around 2 liters and I used 1 liter. It will be very good. And we have a small incision here. It's about 2 centimeters. Exactly 2 centimeters.
Yeah.
And in long term we won't have any issues. We will be doing massage here since it's very swollen, and I did also J plasma. It will be very nice. Let's come here.
Okay, Julia, what would you say to others who are considering the same surgery?
I just say do it because it's the best. It's the best professional I have seen in my life. I feel quite confident about the result. I know that it's quite early, but I can already see the result and I'm quite happy for it. And just do it. It's
Okay, that's very good. So if you had to do it again, you would do it. It is okay.
Sure.
Okay to handle with the pain and everything.
No. This is the small part.
Okay.
Yes, just for days, okay? After it's becoming easy to deal with this.
Oh, that's great. And doctor, what do you see was it what you expected? And what would you inform the patients who are still thinking about this surgery?
Actually, Rib Remodeling Surgery is a revolutionary technique, actually, especially for the patients who has a prominent chest cage. After doing liposuction, we were not able to do actually a very significant reduction in the mid waistline. And patients who are admiring to get these results, actually, this is a very good technique. Without any incision, we can create green stick fractures at the ribs safely.
No scars.
There will be no scars, there will be only 3 small needle holes on each side, and with this technique we can shape them, and with a good aftercare we get very amazing results. This is only a few days after surgery and we already seeing the results, and after 2 months, after full healing, we will get amazing results and we will get a very nice shaped body.
Okay,
Safely.
Thank you very much.
Thank you.
Thank you. Now to see you soon. Bye.
Bye.